Every year, as crops are harvested in Lenawee County, dozens of community partners join together to provide medical care and other support services to the agricultural workers who help bring our food from farm to table. Coordinated by Community Action Agency, these migrant clinics pop up weekly during the summer months as volunteers from University of Michigan Medicine, Michigan Department of Labor, DHHS, Southeast Michigan Migrant Resource Council, and others descend like a force of nature upon the bountiful fields in Southeast Michigan. Ada Rodriguez has been the Migrant Clinic Outreach Coordinator at Community Action Agency for the past 12 years and says that the clinics may serve up to 200 workers each year.
This is the only way they can have a medical assistant, otherwise they doesn't, because when they came, sometimes the work is very slow, and then when they can not have any money until they start to work. So when they came and they had any illness or any pain, right away they call me, and then we provide them a clinic, we provide medication, we provide all they need. They need it. Not many people come to the farm to helping them. It's some job agency, very few. And then we are the one of the every year we shop over here what they need, how we can help you, and this is a blessing.
You know, the community really wants to help, but they just don't know how. You know, and then they don't understand the story or the narrative of the 2021 migrant worker. You know, we try to give them as much support as we can and let them know that when they come to southeastern Michigan that they're not alone. That they have folks. They have from service clubs to religious churches and to community action agencies and just that are willing to help and want to do whatever they can do to help and support the workers while they're here.
Having the program, Community Action Agency Migrant Clinic, it's been a blessing to many of the agriculture workers. Since when they come to pick the fields, they basically have different injuries that they may get, or coming from the south to the north, there's allergies and different sicknesses that may arise. And so having the clinical doctors come out and the interns to give them checks and overviews of them really helps to provide them with that welcoming and healthy feeling. It's been a blessing to be able to collaborate with Ada in the clinic and provide assistance. Typically, we just come out to make sure that the workers are doing good, and if they have any questions on their contract or anything like that, we try to help. But mainly we help the clinic with any translation services, unloading things, and just helping with the process of filling out paperwork.
So I've been doing this work for about 20 years, coming out with our trainees. We bring out medical students from University of Michigan Medical School, and also residents in the family medicine, internal medicine, pediatrics, and now dermatology residency programs. It's a wonderful opportunity for our trainees to work in a very different setting than in the clinics and in the hospitals. And I think this population otherwise is somewhat invisible to our trainees and a really unique underserved population. So the trainees really love this opportunity, and the faculty that join me in precepting this tends to be the highlight of our clinical year as well. So it's really nice to be able to give back, to be doing clinic in a very different setting for us as well, using more of our clinical skills, and just being with people from the community, such as Community Action Agency. That partnership, it just really, for a lot of us, I think, reminds us about why we do what we do, and we can make a difference even in a small way for these farm workers who may only be here for a few months.
Oh, to me, I mean, I've always liked things about like giving back, and when I got the message that there was something like this, I was like, oh, something that I always used to do back in New York, so it's nothing different. I really like it because I come in, I see some, like for instance, the first time I came in, I saw some dermatological conditions that I had never seen before, and even people that had been in dermatology for a long time say like you rarely see them. So it's kind of like I'm learning from them, they're gaining from me, I'm also gaining from them in some way. Yeah.
So just like Stephen, I have always being very passionate about volunteer work, especially now that I'm in Michigan. I have very little contact with the Hispanic community, and for me, somebody that was born and raised in Mexico City, I have very few opportunities to work in Spanish. So this is something that is very dear to my heart, that I be able to speak with people from my same country, speak the same language, make the same jokes, and hopefully be able to be a little bit useful with the knowledge that I have.
We are actually one of the only programs in the country that has a Spanish language track. It's a Spanish language and community medicine track, specifically designed for residents that want to get better at medical Spanish and treating patients that speak Spanish only. My clinic site is in Ypsilanti, where there's a sizable Hispanic population and Spanish-speaking population. So we get a lot of practice daily in our clinics, and then also we work with migrant farm workers, which is where we are today, and then we also do work with like the Mexican consulate in Detroit and with the Latin American Medical Student Society in the University of Michigan Medical School. So it provides kind of opportunity throughout the 3 years to get exposure to that.
The students and residents kind of run the show here. We're just here to supervise them. So it's a nice opportunity for them to have some autonomy with patients in a way that they don't always get in the clinics and the hospital as well. So I think for the trainees that come, it's not only eye-opening to learn about this population and the types of health disparities that they have, but also to have an opportunity to practice their clinical skills and their history-taking skills in a very different setting. We see a lot of musculoskeletal complaints, a lot of rashes, sometimes infectious things, colds, infectious rashes, things like that. And I think it's just, for us, really nice to be able to offer a service to these folks in sort of whatever they are interested in, asking us about, seeking care for. We will try to do what we can, even though our funding and our ability to make referrals or do tests is somewhat limited.
Challenging things out here is just, I think, resources. We're so used to being in a clinic that's fully staffed, and you can, in our clinic, we have a lab on the first floor that our patients can go to and get lab work, and we can have that immediately. Here it's a little bit different. We do things, through a paper chart, and if we want to get lab work or refer them somewhere, it's a little bit more of a process. So that's just kind of learning as you go, how to do that logistically.
This is a very important clinic because of the fact that it comes right here to the farm and checks us out. And typically we don't have time because of our busy schedule to go out to the clinic and get checked out. And many times we also don't even go to the clinic until something's really wrong. So it's so nice to have this opportunity to get checked out, and if there's something wrong, we can catch it on time. So we're just blessed and thankful that you guys are out here providing clinicals, and very appreciative since they come here to work and they're able to get clinical visitations and get checked over.
We've been partnering with Community Action Agency for 15 years or more. It's just been a wonderful collaboration for us at Michigan Medicine, and I think that's a really important piece for the trainees as well, to see how partnerships with community agencies and social service agencies, how that really can help address health disparities with populations and give trainees at least a sense of how they might do that in their future careers.
It's such a great opportunity to be able to help out in this way. Most of these farm workers here are only here for a limited amount of time, and some of them, aren't able to get healthcare benefits or any assistance while here, just because they're here on a temporary permit or visa. So they would otherwise go this time period without any healthcare access, otherwise, if there weren't these opportunities like this. So it's really nice to be able to provide the help that we can. Obviously it's a little limited, but at least get them on the right track, and at the very least be an ear to listen to them, and help out as best we can.
Checarle a este señor su presión otra vez en 2 semanas. ¿Cómo podríamos lograr?